Hi, my name is Andrea Green, PN student, and today I'm going to be demonstrating mixing and administering insulins through injection and a pen as well. So first I'm going to start with my provider's orders and my MAR, making sure that I have the correct patient. So I have Shirley Coast, 54, female. Shirley Coast, 54, female. Her date of birth is 5/14 of 64, 5/14 of 64. Her doctor is Dr. Leo, and she's in room 211-1. 211-1. So that all matches up, so I have the correct patient. So while I compare my healthcare provider's orders to my MAR, I'm just going to do my hand hygiene and Dawn gloves at the same time. So first I have my demo dose NPH insulin U100, 15 units sub-Q daily with supper. So I have my demo dose NPH insulin U100, 15 units sub-Q daily with supper. I have my demo dose regular insulin U100, 10 units sub-Q, and that is BID. Demo dose regular insulin U100, 10 units sub-Q BID. And then I have my Practi Insulin Lispro U100 insulin pen. Practi Insulin Lispro U100 insulin pen. And that is a mild sliding scale sub-Q TID with meals. Mild sliding scale sub-Q TID with meals. So with my sliding scale, I know that I have to know the blood glucose before administering the insulin, so I know how many units to give. So now that I know that all that matches up, I can go on to my medication checks. So first I'm going to make sure I have the right patient bin. So I have Shirley Coast, 54, female. Shirley Coast, 54, female. Date of birth, 5/14 of 64, 5/14 of 64. Dr. Leo, room 211-1 and 211-1. So I have the right patient bin, and now I can go ahead with my first medication check. So I'm going to start with my demo dose NPH insulin U100, 15 units sub-Q daily with supper. So first I'm going to make sure that I have the correct patient, as these are multiple use vials and they're only used for one patient. So I have Shirley Coast, 54. Date of birth, 5/14 of 64, Shirley Coast, 54, 5/16 of 64, Dr. Leo, room 211-1. Perfect, so I know I have the right vial. So I have my demo dose NPH insulin. I have my NPH insulin. This is a U100, and I need 15 units for that one. Okay, next I have my regular. So first I have Shirley Coast, 54, female. Shirley Coast, 54, female. Date of birth, 5/14/64, 5/14/64. Dr. Leo, room 211-1. Dr. Leo, room 211-1. So I have my regular insulin. So this is my regular insulin, and it is a U100, and this is U100. And I know I need 10 units of this. So these two insulins we already know can be mixed together to, so you can only give one injection instead of two. And so for that, the onset is 30 to 90 minutes. So next I have my insulin pen. So I need my Practi Insulin Lispro U100 insulin pen. And first let's make sure I have the right patient. There it is, Shirley Coast, 54. Shirley Coast, 54, 5/14/64, 5/14/64. Dr. Leo, 211-1. Perfect, so that all matches up. So I have my insulin pen. So I have my Practi Insulin Lispro U100. Practi Insulin Lispro U100 insulin pen. So now that I have all my medications, I can begin with my second medication check. So I'm just going to take out of my bin everything that I'm going to need. These. And I will need some labels as well, and my needle for my insulin pen. Oh, and the onset for the pen is 5 to 15 minutes. So now we can begin with my insulin with a needle. So we'll clean the tops off of both of these. Before we do so, I'm just going to mix the NPH, as it is a cloudy insulin, and sometimes it can settle. Okay, so that's all mixed now. And then I will clean the tops of both of my insulin vials. For about 5 to 15 seconds. Okay, and then I can do my second one. So now that those are clean and my back has not been turned to the field, I know that I can go ahead and get my needle ready. So I need 15 units of the NPH and 10 units of this regular. So because we don't want to mix them once they're in, into each vial, so I'm going to draw the air into the NPH first so it already has the air in it. So I'll need 15 units of air, as that is what I need for my NPH. So there's my 15 units of air. And then I will inject it into my NPH. So I have my NPH here. And then just inject my air. Okay, and then I will need 10 units of air for my regular. So I have my 10 units of air and I have my regular insulin here. So I will need 10 units of air. And then I can start to draw up. So I'm just going to turn this so you can see the regular. And then I will need 10 units. Okay. Just make sure I get that air bubble out of there. Okay. So you see that I have the regular insulin and I have 10 units of that. So now I can switch to my NPH, and I've already cleaned it so I don't need to clean the top again. And put my needle in, and because I need 15 units of this, I know that I need to go to 25. So I have my NPH, and now I will bring it down to 25. Okay, so now I have NPH and 25 units, which makes my 15 units of NPH and my 10 units of regular insulin. So now I'll do the one-handed scoop method and grab it by the sides and push it down just so then it can't poke out the top just in case. So now that I have that, I will label. So I have my NPH and I have 15 units of that, and then I have my regular and I have 10 units of that, and it is October 9th of 19, and it is about, so these are my 5:30 p.m. meds, so 17:30, and it is 17:50 right now, or sorry, 17:15 right now. Okay, so now I'm just gonna put this onto my needle for when I do my third medication check and know how many units I have to give my patient. And while I was on my way back to the med room to prepare her insulin, I actually seen that my patient's supper trays were going down the hallway, so by the time I get there, I know that she will have her supper in front of her and ready. So, my camera person verified that insulin, so now I can move on to my Practi Insulin Lispro U100 insulin pen. So this is my Practi Insulin Lispro U100. So I can clean the top of this. Now my CNA had already reported to me that my patient's blood sugar was 178. So with it being 178, I need to give my patient 2 units of insulin as per my mild sliding scale. So as I clean this off, okay, I'll let that dry. And as that dries, I'm just going to put their blood pressure, or sorry, their blood sugar. So it was 178, so I'm going to be giving 2 units. Okay, so now that that has dried, I'm just going to open this, make sure I have the correct needle. 0.3 millimeters by 5 millimeters, third gauge by 3/16. That sounds right. Okay. So now I will just twist my pen onto my needle. And I will just take off this plastic cap, but I will put it back on to keep my needle sterile, just so I can show you priming it to 2 units, which I need to do, and then I can set it to my 2 units again. So I have my 2 units primed. Okay, so my 2 units are primed, and then I will just push up until you see liquid. And you can see the liquid. So now I can set it to 2 units, and I will have my second nurse verify that, and another coworker. So it is verified to 2 units. Okay, verified to 2 units, and then I will do the one-handed scoop method. And pull down at the top. And although this does have my patient's name on it and all that, I'm still gonna put a label on it, because then I know exactly how many units I drew up. So this is my insulin pen, so this is Lispro, and I have 2 units. It is October 9th of 19, and it is 17 at the time. Okay, and I'm just gonna put this on my pen, but I don't wanna cover up any of my patient's information. So I'm just gonna loosely put it on here. Kind of like that. Okay, so now I have all of my my stuff ready. So I'm just going to clean up my workspace so I can go into my patient's room. And I'm going to deglove. As I leave my med room, make sure my workspace is tidy, and move over to my patient. Hi, how are you today? Oh, that's good. My name is Andrea, and I'm your nurse today. And I seen your supper's already on its way, so I went and prepared your insulin. Can I get you to confirm your name and your date of birth for me? Okay. Shirley Coast, 54, female. Good. And your date of birth? 5/14 and 64? 5/14 and 64, perfect. And do you have any allergies? Codeine, yeah, I see that. And it does say that on your MAR and your wristband, so that's perfect. So your MAR matches up with the patient's wristband, so I'm okay. I have the right patient. I'm just going to do some hand hygiene and grab my gloves so I can administer my insulin. So now your supper is here. Does it look like a good supper? Like, are you going to eat your supper? Yeah? Okay, perfect. So I'll go ahead and give you your insulin. Do you usually give injections to yourself at home? You do? Okay, and where do you usually give them? On your abdomen? Okay, we will stick with that spot then. And I'll make sure I have 2 injections for you today, so we will rotate the sites to make sure there's no tissue damage from repeated injections. So I'm just going to raise your bed to an appropriate height for me. Okay, so I'm just going to expose your abdomen, Shirley. Okay, so Shirley, first we have for you your NPH insulin and your regular insulin, which can be mixed in a needle. So I only have to give you 1 injection for that today. So I have your NPH and your regular, 15 units and 10 units, which makes 25 units in total, which is what I have. So, okay. So Shirley, I'm just going to wipe off your abdomen really quickly. Okay. So I'm going to grab my needle and decap it. And then I'm going to pinch the skin. So her skin is dry from cleaning it. So I'm just going to pinch the skin. And I'm going to go at a 90-degree angle. Okay, Shirley, on the count of 3, I'm going to put the needle in, okay? 1, 2, 3. Good. I'm just going to inject it slowly because it can burn, while continuing to pinch the skin. Okay, and then I can pull it out, and I will hit the safety on my needle, and I will throw it out right away into the sharps container. Okay, so Shirley, I have your second injection, which is your pen, and I'm just going to move injection sites to the other side of your abdomen. So I'm just going to clean it off again, and now I'm on the other side of your abdomen. Okay, and as that dries, I'm just going to mark down that I have given her first insulin injection. Okay. So this one I'm going to be giving on the other side of your abdomen. Okay. So this one is your Lispro. U100 pen, Practi Insulin Lispro U100, and I have my thing, 2 units, and it's still at 2 units. So I've already decapped it, so now I can go ahead and give the injection, and I've already wiped it down. So now that it's dry, I will pinch the skin. Okay, Shirley, on the count of 3, I'm going to inject it, okay? 1, 2, 3. Good. I'm going to go until I hear that click, and then I'm going to release and count for 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Okay, Shirley. So now you can see that my safety is on from the red on the needle, so I can just uncap that. And I can put it in the Sharpie container. And then I would clean up her stomach if there's anything, and pull down her gown and pull back up her sheets. Okay, Shirley. So I'm going to sit with you while you eat, if that's okay, just to make sure that you eat enough food for the insulin I just gave you. So I will pull your meal up to you, and I will sit with you while you eat. And then I would take off my gloves, do hand hygiene, clean up my workstation, document what I did today, and make sure there's no other needs for my patient before I leave the room.